I'm Matt Willis, Public Health Officer from Marin County with a COVID-19 update for July 19th. We're starting into a new chapter of our pandemic response in Marin. Yesterday, we received the results of COVID-19 genetic testing from the first 2 weeks of July, and 90% of our samples were the BA.4 or BA.5 variant of Omicron. Very soon, we can assume new cases are infected with BA.5. I want to talk about what this might mean for us and why masks are going to be an increasingly important tool for getting us through the summer. This will be the fourth significant Omicron variant to take over so far this year. It's good to step back and remember why new variants emerge in the first place. The latest variant is always better at spreading than the one before because they essentially outcompete the prior strain. So it makes sense that they're more contagious. One of the reasons BA.5 is taking over is that it's better at sidestepping the immunity that we've gained. Mind you, the asset of high vaccination levels is still critical for us as a community, especially in preventing severe illness and death. But it's not protecting us against infections as well as it did in previous strains. So in BA.5, we're facing a strain that's one, more infectious, and two, that's not as intimidated by our high levels of immunity. Which brings us to masks. As I move around our community, I see people walking around with a mask on their sleeve or in their pocket or purse, and pulling it on when they enter an indoor space, using it for a few minutes while they're inside, and then taking it off as they exit. It's a decision being made in real time based on reading the situation. And that's perfect. And that's what we all need to do. It's not really more complicated than that. I'd like to offer one of the most important facts I find useful in my own decision making about wearing a mask. I want to know how likely it is that someone else around me is infectious and might be spreading the virus. For example, if I'm in a grocery store with 50 people, what are the odds I'll be exposed? It turns out we can actually answer that question for Marin with some basic epidemiology. In Marin County, we estimate that approximately 1 in 20 of us is infected with COVID-19 right now. An estimated community prevalence of about 5%. Here's how we get to that number. Our wastewater shows the same amount of viruses circulating now as we found in the January Omicron surge. And yet our reported case counts are about 1/3 of what they were at that time. So right off the bat, we know that reported case rates are a major underestimate. A better window into true prevalence is this. Everyone admitted to the hospital is tested no matter what you're coming in for, whether it's a broken leg, or it's time to deliver your baby, or it's an elective surgery. Among those people coming in from our community who may not have symptoms, but do get tested, about 5% turn out to be infected. That's what we call incidental COVID hospitalizations. And you can see these on our dashboard. We assume these people represent our community as a whole and can apply this data to predict risk for all of us. So here's how to use that number in your own decision making. With 5% of people infected, if you walk into an indoor space with 50 people in Marin today, there's a 92% likelihood that at least one other person there is infectious. In a room of 25, that comes down to a 75% chance. And with the BA.5 variant now making up almost all of our samples, this means we're being exposed to a highly contagious variant that isn't really as put off as easily by what our immune system throws at it. So if you're serious about not getting infected, a barrier like a KN95 mask that prevents you from inhaling the virus and from spreading it to others is an increasingly valuable tool. Thankfully, high-quality masks are easy to find these days. No one wants to wear masks forever, but I hope we can see it as a small but very helpful step to take now. Knowing the data about your risk of exposure based on prevalence and being smart about when and where you mask up will help protect all of us through this summer. Thank you for doing your part.